Selena is a 19-year-old college freshman accompanied by her mother, who presented after being referred by her primary care physician due to academic problems in school, leading Selena to want to drop out. Selena had returned home to visit her family unexpectedly a week ago after having a bad week at school, and told her family that she was thinking about quitting school. Selena's mother took her to her primary care physician's office, who noted Selena to appear polite and cooperative, but unengaged and seemingly unmotivated. Selena's mother reports that Selena has great potential and doesn't want to fail or drop out of school, and wonders if her ADHD is back, noting that she thought Selena had outgrown this years earlier. Selena started college away from home 6 months ago and has reported to her family that she has continued to struggle since starting, characterized by doing poorly on tests and having trouble staying organized, despite reporting that she's trying her best. Selena's academic struggles have led to constant worrying about failing out of college, poor concentration, general sense of hopelessness, and insomnia. Selena returned home after failing yet another test at school and told her mother that she thinks it might be in her best interest to quit school because she'll never be able to graduate. Selena's mother had previously taken Selena and her older sister for testing when they were in elementary school due to issues reported by both of their teachers related to the girls both getting into trouble at school, not following instructions, not completing homework, and getting out of their seats, in addition to not listening and being generally disruptive. At that time, Selena was 9 and had been diagnosed with ADHD. Selena's sister was also diagnosed with ADHD around the same time. Selena's mother did not agree with the recommendation to try psychopharmacotherapy and instead worked extra hours to pay for tutors to help Selena with her academic difficulty. Selena's assessment at that time confirmed reading fluency and comprehension problems, but did not meet criteria for a learning disability, and thus she did not receive special education services. Notes from Selena's previous assessment indicated she and her family moved to the United States from Mexico when Selena was 5. Although it is known that English is Selena's second language, it is not noted with what level of ease she learned it. Selena was retained in first grade, noted to be due to difficulty learning to read as well as behavioral immaturity. Selena's father, who passed away when Selena was 7, was noted to be dyslexic and had dropped out of college after one semester. Selena presents to the clinic well-groomed and casually dressed. She often pulls her hoodie over her face, was quiet and disengaged. It appeared as though she did not want to be there, and her mother forced her to go. She was mostly quiet, sat in a slouched position, and would provide short verbal responses like, I guess, and would simply shrug her shoulders or say, I don't know. She was noted to have a slight Hispanic accent, although her English proficiency was noted to be strong. Selena's reading and writing scores were noted to be considerably below those expected for her age. Additionally, Selena struggled with spelling and written comprehension. Notably, Selena's learning struggles were not attributable to intellectual disability, issues with vision or hearing, psychosocial adversity, or lack of English proficiency. Selena reported that since starting college, she has been unable to remain focused while reading and listening to lectures, being easily sidetracked, which led to her having trouble with her written assignments. This information was all corroborated by Selena's mother during the session. Selena also reported often feeling worried, agitated, and restless, that she had trouble falling asleep, was always tired, and didn't feel like she could have fun like her other friends at school did. Selena reported that the depressive symptoms went up and down throughout the week, but did not seem to influence her concentration. Selena denied history of substance abuse and has never been on any medications. Selena reported that she had less difficulty in high school as she had a really great group of teachers who helped and supported her. They allowed her to record lectures and to use other tools like videos and visual presentations for final assignments. Selena denied having such supports in college and that she felt stupid, like a failure, and lonely. Selena reported that she had not registered with the university's Student Disability Services office although she had been advised to do so by her teachers that had helped her so much in high school. Selena reported not doing so due to not wanting to be seen as different and wanting to get through college on her own. At this time, I am seeking guidance in determining the best diagnosis for Selena and how to best assist her. As noted previously, Selena is Hispanic, and I need to evaluate if her cultural background contributes in any way to her presenting and reported symptoms, as well as her responsiveness to receiving help. Selena has a previous diagnosis of ADHD about 10 years ago, and her mother implemented tutoring, but never any pharmacological treatment as recommended. Could this be the same diagnosis from a decade ago, or could this have progressed into something more complex? Or could it be something different altogether? What are your ideas on the most appropriate diagnosis and course of treatment for Selena?